Wrong organ surgery. A man went in for surgery to save his life. But hours later, he woke up to a nightmare. It wasn't his illness he had lost, but his body itself. This happened in a general hospital in Florida, 1995. He was scheduled to have his right leg amputated. When he woke up, it was his left leg that was gone. How could this happen? The surgeons had marked the wrong side. They followed every checklist, every protocol, but no one double-checked the checklist itself. One small mistake, a misplaced arrow, a rushed note, a misread label, and a life was shattered in minutes. It wasn't just the leg. Across hospitals in Tokyo, Rhode Island, and beyond, wrong kidneys, lungs, ovaries, and even hemispheres of the brain have been removed by mistake. Tiny human errors with devastating consequences. Studies suggest wrong site or wrong organ surgeries occur in roughly 1 in 10,000 procedures, though many cases go unreported. The physical loss is obvious, but the psychological trauma, fear, anxiety, distrust lasts far longer. Hospitals learned the hard way. New rules were introduced, mandatory timeouts, double verification of the surgical site directly on the patient, and team briefings before every operation. The rule is simple. Mark the correct side on the patient's body itself before surgery. A rule born from tragedy, not theory. Anesthesia nightmares. You think anesthesia makes surgery painless? But for some patients, it becomes a living nightmare. In the U.S., 1984, reports began surfacing of patients fully conscious during surgery. They could hear every instruction, feel every cut, know exactly what was happening. Yet their bodies were completely paralyzed. Sometimes it's a dosing error, sometimes faulty equipment, sometimes simple human error. The patient trusts the medical team completely, unaware that one tiny mistake can turn a routine operation into trauma that lasts a lifetime. Studies suggest this happens in about 1 to 2 per 1,000 general anesthesia cases. Rare, but far more common than most people realize. Survivors often suffer nightmares, anxiety, and even PTSD, reliving every horrifying moment for years. Hospitals learn from these incidents. Today, protocols monitor anesthetic depth closely, double-check dosages, and ensure immediate intervention if awareness occurs. Even a single lapse, a miscalculated dose, a misread monitor, can turn what should be a routine operation into a nightmare the patient never forgets. Objects left inside the body. Surgery is supposed to save lives, but sometimes it leaves a hidden nightmare behind. In 2007, a woman in California discovered a surgical sponge forgotten inside her months after an operation. In 2018, a patient in Japan lived with 2 sponges in her abdomen for 6 years. Even in New York, multiple patients have suffered similar retained surgical items errors in recent years. How does this happen? Rushed procedures, miscounted tools, miscommunication in the operating room. Sometimes the checklist is ignored, sometimes incomplete. Tiny oversights in a high-pressure environment can have devastating consequences. The consequences are brutal. Patients endure pain, infection, and additional surgeries. The physical toll is severe, but the psychological impact, fear, anxiety, and loss of trust in doctors often lasts even longer. Hospitals learn the hard way. Today, every sponge and instrument is counted multiple times, sometimes tracked electronically, and teams verify the patient is free of foreign objects before closing any incision. One tiny mistake, one forgotten tool. A life-saving operation can quietly turn into a preventable disaster. Wrong patient surgery. One small mistake, and a life-saving operation can go to the wrong person. In Tokyo 2000, 2 patients were accidentally swapped. One underwent heart surgery they didn't need, while the other missed a procedure that could have saved their life. In 2011, a hospital in New York nearly operated on the wrong patient during a knee replacement. These aren't isolated incidents. They happen worldwide, across the US, Europe, and Asia. How does this happen? Charts misread, wristbands ignored, rushed admissions. Human error in a high-pressure environment can completely change someone's fate. Patients trust doctors and nurses completely, unaware that a small administrative oversight can have devastating consequences, physical, emotional, and sometimes even fatal. Hospitals learn the hard way. Today, strict verification protocols are standard. Staff double-check patient identity, confirm procedure details verbally, use barcode systems, and perform a team timeout before surgery. One tiny error, one misread label, a life-saving operation can instantly turn into a preventable disaster. Fire in the operating room. A fire breaking out during surgery sounds impossible, but it has happened. In 2014, a hospital in Texas faced a terrifying incident. During a chest operation, a malfunctioning electric cautery tool ignited oxygen-rich air. Flames erupted dangerously close to the patient. The surgical team had to act instantly, controlling the fire while keeping the patient alive. How does this happen? Operating rooms are full of flammable materials, oxygen tanks, alcohol-based disinfectants, and surgical drapes. One tiny spark, a faulty device, static electricity, or human error can trigger disaster. Patients are completely helpless under anesthesia. The dangers aren't just burns. Smoke inhalation, surgical complications, and even death are real risks. Hospitals learned the hard way. Now, flammable materials are carefully separated from open flames. Equipment is regularly checked, and surgical teams are trained to respond instantly if something goes wrong. One malfunction, 1 second, a routine surgery can suddenly become a life-or-death emergency. Brain or spine mistakes. One wrong cut in brain or spine surgery can destroy a life in seconds, and it happens more often than hospitals admit. In 2007, an 86-year-old patient in Rhode Island was rushed in for emergency brain surgery. A nurse failed to record which side needed operation. Relying on memory, the surgeon started on the wrong hemisphere. The error was caught, but the patient tragically died 3 weeks later. Shockingly, this was the third wrong-side brain surgery at that hospital in 6 years. Fast forward to 2017, in Hong Kong. An 86-year-old man was prepped for neurosurgery, but the surgeon drilled into the wrong side of the skull. The second such mistake at that hospital. In 2018, Kenya's largest hospital experienced a patient mix-up. 2 men with similar names were admitted. The surgeon operated on the wrong patient entirely. How does this happen? Mislabeled charts, misread imaging, rushed decisions, tiny human errors, a wristband ignored, a scan misinterpreted, can completely change someone's fate. Patients lie unconscious, trusting the team entirely, unaware that one small mistake can turn life-saving surgery into catastrophe. These incidents aren't isolated. They've happened worldwide. Hospitals responded. Strict verification protocols. Double-check identity, confirm procedure, mark the site physically. One tiny mistake, one misread label. A surgery meant to save a life can instantly become a preventable disaster. Air embolism deaths. Air, something we take for granted every second, can become a silent killer inside the human body. During surgery, even a single air bubble slipping into a vein can block blood flow to the brain or heart. And when that happens, death can strike in seconds. It's called an air embolism, a tiny invisible killer. Doctors have reported shocking cases. In 2012, a woman in Oregon died instantly when air entered her bloodstream through an IV line. In India, a 35-year-old man suffered cardiac arrest during routine brain surgery, later traced to trapped air. How does this happen? A loose IV line, a syringe not properly flushed, a surgeon working near open blood vessels under pressure. Sometimes it's a rushed moment. Sometimes a tiny oversight, but the result is catastrophic. Today, surgeons fight this invisible enemy, filling lines with saline, keeping patients in special positions, and using air detectors during critical operations. Because one misplaced bubble, one invisible mistake, can turn a routine surgery into a fatal emergency in an instant. Transfusion tragedies. Blood, the very thing meant to save your life, can also end it in minutes. Give the wrong type during surgery and the body goes to war against itself. Organs shut down. Death can follow within hours. One of the most shocking cases happened in 2003 at Duke University Hospital. A 17-year-old girl, Jessica Santillan, received a heart and lungs from a donor with the wrong blood type. Her body immediately rejected the organs. A second surgery couldn't save her. This wasn't an isolated mistake. In the UK, a 2011 report showed transfusion mix-ups, often from mislabeled bags, still happened more than 150 times a year. How does this happen? A mislabeled bag? A rushed nurse? 2 patients with similar names? Sometimes the smallest oversight has irreversible consequences. Hospitals learned hard lessons. Barcodes, digital scanning, double nurse verification. Every precaution now in place before a single drop of blood enters a patient. Because one tiny mistake, one overlooked label, can turn a life-saving transfusion into a fatal disaster in minutes. Drug and dosing disasters. A single drop, That's all it takes to turn medicine into poison. In 2006, at an Indiana hospital, a newborn received 10 times the normal dose of heparin, a blood thinner meant for adults. Within hours, the baby started bleeding internally. A misplaced decimal, a moment's distraction, and a life that could never be undone. Then, across the world in 1994, a patient in the UK was injected with potassium chloride instead of saline. Two clear liquids side by side. One heals, the other stops the heart in seconds. These tragedies don't always come from negligence. Sometimes it's exhaustion, sometimes it's chaos. Identical vials under bright lights, rushed nurses, or confusing storage systems. Sometimes it's just human error. After disasters like these, hospitals change the rules. Color-coded labels, barcode scanning, and double-check verification became mandatory in operating rooms worldwide. But the lesson remains chilling. In surgery, one wrong measurement isn't just a mistake. It's a moment that decides whether a patient lives or dies. Sterilization failures. Hospitals, the very places meant to heal, have at times turned deadly, all because surgical tools weren't clean enough to save lives. In 2008, a Las Vegas clinic made headlines when reused syringes caused a hepatitis C outbreak, exposing nearly 50,000 patients across the world, from the UK to India. Similar lapses led to infections like MRSA, HIV, and hepatitis spreading inside operating rooms. Not from disease, but from neglect. Sometimes it's a rushed schedule, other times poor training or faulty machines. One unsterilized clamp, one contaminated scalpel. An infection enters the bloodstream before anyone realizes it. In 2021, a hospital in Kentucky halted all surgeries after discovering its sterilization machines had failed for months. Hundreds of patients had already gone under the knife. The fix sounds simple. Autoclave, clean, repeat. But when cost-cutting or complacency creeps in, that routine turns into roulette. A single speck of bacteria can undo hours of perfect surgery. The operation might go perfectly until the infection no one saw coming takes it all away. Robotic surgery gone wrong. Surgery has gone high-tech. Robotic arms promise precision, smaller incisions, faster recovery. But machines aren't flawless, and when they fail, the consequences can be catastrophic. In 2012, a patient in California underwent a routine robotic-assisted prostate surgery. Midway, the robotic arm malfunctioned, making an unintended incision. The surgeon managed to control the situation, but the patient suffered serious internal injuries. In 2015, a hospital in Germany faced multiple complaints after early robotic systems misfired during laparoscopic surgeries, causing accidental cuts and extended recovery times. These aren't isolated events. Early adoption of surgical robots worldwide came with a steep learning curve. Sometimes it's a technical glitch, sometimes miscommunication between the surgeon and the machine, and sometimes human error compounds the problem. Even the most advanced systems rely on people to guide them correctly. After repeated incidents, hospitals introduced stricter training protocols, simulator practice, and machine safety checks before live surgery. Robots can perform incredible feats, but in the wrong hands, or when the system fails, even a high-tech marvel can become a dangerous weapon. Misdiagnosis before surgery, a healthy kidney, an ovary, even a portion of the stomach, all removed because doctors thought they were saving a life. In 2003, a woman in Tokyo was told she had a tumor in her kidney. Surgery was scheduled immediately, but when the operation began, the surgeons discovered the organ was perfectly healthy. A misread scan, a rushed review, had caused a life-altering mistake. And this isn't rare. In 1999, a healthy ovary was removed in the US after a misread ultrasound. In 2010, a patient in Europe underwent a partial stomach removal, all because of a false positive biopsy. Sometimes it's a rushed decision, sometimes it's simple human error. The patient trusts the doctors completely, unaware that a single misdiagnosis can have life-changing consequences. Studies suggest misdiagnosis contributes to 10 to 15% of all hospital errors worldwide, and many of these result in unnecessary surgeries. The damage isn't just physical. Anxiety, depression, and fear of future surgeries can last for years. Hospitals learned from these tragedies. Now, stricter protocols are in place. Double-checking imaging, confirming lab results, mandatory second opinions, and verifying patient identity before any irreversible procedure. One wrong diagnosis, and what should save a life can become a disaster that lasts forever. Plastic surgery disasters. Cosmetic procedures promise transformation, but sometimes they deliver tragedy. In 2009, a woman in Brazil underwent liposuction. Complications from anesthesia led to multi-organ failure. 2 years later, in the U.S., a patient suffered paralysis after a botched fat transfer. Even minor procedures can spiral out of control if protocols aren't followed. Anesthetic miscalculations, surgical errors, equipment failure. Any one of these can have permanent consequences. Patients trust that cosmetic surgery is routine, low risk, but a single mistake can cause disfigurement, disability, or even death. These tragedies forced hospitals and clinics worldwide to tighten monitoring, pre-op checks, and emergency response protocols. Plastic surgery can promise beauty and confidence, but in the wrong hands, it can become a lifelong nightmare. Post-surgery negligence. Surgery might save a life, but what happens afterward can kill. In 2025, 17-year-old Amin Nourouzi had emergency spinal surgery in New York. The operation went well, but post-op care failed. His fever went untreated, complications were missed, and 4 days later, he tragically passed away. In 2023, a young woman in India faced life-threatening bleeding after childbirth. Delayed treatment and even an empty oxygen cylinder contributed to her death. In 2024, a patient in the UK suffered severe complications after a surgeon incorrectly closed an abdominal wound, trapping part of the small bowel. Staff shortages, miscommunication, obvious warning signs ignored until it was too late. Patients trust hospitals to continue caring for them after surgery, but lapses in monitoring, medication, or wound care can turn a routine recovery into a life-or-death battle. Hospitals learned hard lessons. Stricter post-op monitoring, better nurse-to-patient ratios, and mandatory follow-up checklists are now standard worldwide. Even when surgery goes perfectly, post-operative negligence can make survival the real challenge. Equipment malfunction. Even the most advanced surgical tools can fail. And in the middle of an operation, that failure can be catastrophic. In 2018, a hospital in California faced a sudden electric cautery tool malfunction during chest surgery. Sparks flew, equipment overheated, and the operation nearly turned into disaster before backup measures kicked in. In 2015, a monitoring device in a European hospital gave false oxygen readings during a critical procedure, delaying life-saving intervention and putting the patient at serious risk. In 2025, a power outage at a government hospital in Bhopal, India, disrupted surgeries, halting critical equipment, and endangering patients mid-procedure. Sometimes it's technical failure, sometimes it's improper maintenance. Sometimes backup systems aren't checked until it's too late. Surgeons depend on precision instruments, monitors, and life support devices to perform delicate operations. But a single equipment failure can escalate complications in seconds. Hospitals now enforce strict equipment checks, regular maintenance schedules, and backup protocols to prevent near catastrophes. Even in the hands of skilled surgeons, faulty equipment can turn a routine surgery into a race against time. Thanks for watching. Don't forget to subscribe, and we'll see you in the next one.